Now recognizing the ranking member for opening statement. I yield to the ranking member for an opening statement.
Good morning, Madam Chair.
Thank you, Madam Chairman.
Distinguished gentlelady from California, Mary Bono.
Gentlelady is recognized. Chair now recognizes the lady from California is recognized.
I'm pleased to introduce Congresswoman Mary Bono, former U.S. Representative for California's Inland Empire and Desert Region from 1998 to 2013.
Mr. Speaker, I yield myself such time as I may consume.
Gentlelady is recognized.
Welcome to Sagely Speaking. I'm your host, Mary Bono, and I'm so happy you're here. On this podcast, I hope to bring you insightful conversations with a variety of guests from all walks of life, people with stories, wisdom, and perspectives that inspire and inform. If you enjoy the show, please subscribe, and if you feel inspired, leave a 5-star rating. It helps us reach more listeners like you. Now let's dive into today's conversation. Hello, and welcome to this episode of Sagely Speaking. I am very happy to have today's guest with us. I've known him for, at least a decade or so. I have admired him from afar as well as at events we've done together. He really is a force of nature and beloved by everybody who knows him. He's also sort of an enigma because he looks and sounds so sweet and so kind and all of this, but he's so, decorated. If you have the video on, if you're watching us on YouTube or on a YouTube short, you'll see that he's got tons and tons of diplomas behind him. And so in any event, he is Dr. Joseph Lee, who serves as the president and chief executive officer of the Hazelden Betty Ford Foundation. He is one of the most sought after thought leaders on addiction treatment and mental health care in the entire world. He is known widely for his love-inspired, science-powered approach to care and his impassioned advocacy for all people who are affected by substance abuse and mental health conditions. Just a little bit first about the Hazelden Betty Ford Foundation. It is recognized as the nation's foremost nonprofit provider of comprehensive behavioral health care, harnessing science, love, and the wisdom of lived experience to help individuals, families, and communities who've been affected by substance use and mental health conditions. 2025 is a huge year for them. It is hard to believe, but it is their 75th anniversary as they were founded in 1949. Dr. Lee, welcome to Sagely Speaking.
Thank you so much for having me, Mary. It's great to catch up again.
It is great to catch up. I think we've been traveling a similar road over at least a decade, a lot of policy conversations and discussions and moving the ball forward in this field in any event. But before we get into more about the Hazelden Betty Ford Foundation, let's talk about you. I kind of teed you up as a giant, rightfully so. But what brought you to the Hazelden Betty Ford Foundation and into this line of work?
Yeah, thanks, Mary. I don't know about a giant. I would have to applaud you on all of your advocacy efforts in the recovery community and all that you do for a shared mission. I came to Hazelden Betty Ford through my medical training. I have been touched by this mission. I am not a person in recovery myself. My experience at Duke University when I was an intern was in emergency rooms watching people with addiction in their, they were having their worst moments, I guess. And you could understand why medical professionals at the time would have some stigma about addiction because that's all they saw in addiction. And I had this incredible experience at a residential treatment facility called Fellowship Hall in Greensboro, North Carolina, later in my residency. And I saw some of the very same people that I saw in the emergency room transformed in the treatment center. And that really gave me an inkling about the power of recovery, the humanistic transformation. And I was like, wow, this is what I signed up to do. It's what all doctors signed up to do when they want to see transformation and change and healing. So I kept that in mind. So when I finished my childhood and adolescent psychiatry fellowship in inner city Baltimore at Johns Hopkins, I knew I wanted to do addiction medicine. And in order to get my certification, I had an opportunity to come to Hazelden. It was just Hazelden at the time, not Hazelden Betty Ford. It was before the merger. And that was in 2008. And I've been here ever since, going on almost 17 years now, working with young people and adults, young adults initially and families for a number of years. And then I made the jump to medical director, and then I became CEO in 2021. And it's been a journey that's been just filled with gratitude for me. I get a lot of thanks, but actually I'm the one that's grateful, Mary. And I think people in recovery understand that that I'm the one that's been changed, I'm the one that's been humbled, and my life has been transformed really by being able to serve other people.
Well, that's interesting. And Joe, quick question. I say this often, and you can tell me I'm wrong. I'm a big girl, I can take it. I say often that addiction or substance use disorder is one of the very few diseases that can be healed just by camaraderie, friendship, human connection. Am I right?
Yeah. I think you're right in that. I think community actually plays such a powerful role in many medical and behavioral health conditions, believe it or not. Community, but it's both the individual and the community because the magic of Hazelden Betty Ford is not just in the evidence-based treatments and the data and the publishing arm and the quality of care. It's that we had a hand in building recovery communities for 75 years across the country. And the real recovery happens in those communities and the longevity of those communities. And what happens with those individuals is they give of themselves once they are in recovery. So it becomes this like a virtuous cycle where they volunteer. And the research will say this, that when you are involved in a community, community is not about soapboxing about a particular political issue. Community is really about connecting as a human being and giving of yourself and volunteering and creating something that is greater than the sum of its parts. And so I think there is something really magical about community that enhances empathy, self-forgiveness, motivation to want to be one's best version. And I think all those things happen. So, I mean, of course, in addiction treatment, people still sometimes need medications or they need to get over a detox. They have mental health issues. But if you compare what we do to just generic mental health treatment, I think it's the community that really makes what we do stand out.
So since 1949, I'm assuming things have changed an awful lot since then, and I would start with stigma. This used to be disease that was kept underneath the stairwell. I used to say like the dragon and the monsters, if you remember that old TV show from the 50s and 60s. But they kept that dragon under the stairs because it could never come out. They were hiding it. Right. And I thought, alcoholism or substance use disorder was that dragon. But how has it changed since 1949? And I know you weren't there at the time, so I'm asking you from your historical knowledge.
For the record, I was not there.
Yes, okay.
But it's actually a really cool story, Mary. In 1949, the landscape, there was no addiction treatment anywhere. And addiction literally was a moral failing. Hospitals and psych wards didn't want to have anything to do with people who were addicted to substances. And a group of individuals saw promise in a certain kind of treatment approach based on community, by the way. And they bought a farm in Center City, Minnesota. And this farm was owned by a prominent family in the Minnesota area called the Power family. The owner of the farm was named after one of the owners, Hazel. And so the farm was affectionately called Hazel's Den.
Ooh.
And so they bought this farm. Hazel's Den became the name, Hazelden. And it grew from a farm to basically changing the world and changing the face of how addiction was talked about. Once Hazelden started to have success, the Minnesota model took route and really spread like wildfire across the country and across the world, giving people hope. Later, when we merged with the Betty Ford Center, and the power of Mrs. Ford, and she spoke not just for breast cancer, but she spoke for addiction and recovery in a time when people didn't stand up and speak. And we had this incredible stamp reveal ceremony at the White House earlier in the year. And in that stamp ceremony, I said something to the like, there were millions of Americans that Mrs. Ford, she made them feel seen by speaking. They were able to step forth and whether it was breast cancer or addiction, she spoke about it. So our legacy is both this marvel that started on a farm and spread like wildfire, and the amplification that happened with this powerful female leader who spoke at a time when other people didn't have the courage, and that's the legacy that we humbly carry on. But it's a pretty cool story of the legacy.
I didn't know that about Hazelden. Thank you very much. That's very exciting.
Yeah.
And you might remember this or not, but when I served in the United States House of Representatives, I represented Rancho Mirage, and
Yes.
both President and Mrs. Ford were very good, dear friends were just so special, and I love them. President Ford was my first campaign chairman after he passed.
Oh, wow.
Mrs. Ford continued on.
Yeah.
And I always felt so extremely proud to represent the Betty Ford Center before the merger. And that continued on. My passion for the Betty Ford Center, my respect and all of that carried on. It was transferred immediately after the merger. But if it weren't for Mrs. Ford, you're right. Where would we be? I would hope somebody would have done what she had done eventually. But it wasn't just people who are in recovery or, who are active with their addiction. It's the families too.
Yeah, it's absolutely the families. Yeah, yeah. And you represented it so well, and for the country, and I think, yeah. I mean, if you think about the time when she spoke about her breast cancer journey in the early '70s, just think about, like, it's like secondhand smoke. Like, people don't think anything about it now, but, like, back then it was a different time, and people didn't talk about things like breast cancer, and people certainly didn't talk about things like addiction. And it also opened the doorway for the journey of family members to also speak, because Mrs. Ford's daughter Susan was pivotal in helping her mother get help, and so that narrative also took hold, and then later on the family program and children's program at the Betty Ford Center was really continues to be a magical place where a lot of people get healing adjacent to the person who's actually getting the treatment.
I think this is important to talk about a little. I wasn't planning on it, but having been through family treatment, a few times for various reasons and various people I love. I'm like you, I'm not in recovery, but I just tend to love people who, have had needed treatment a time or two. But it is so important for people to recognize that it is a family dynamic and that they too would be better off, better served, feel better if they participated. And I would say that your program and the children's program truly it was novel at the time, the children's program. They were sort of the unseen victims, if you would, of this disease. Because I don't think people recognize how it does affect the whole family.
Yeah. I think if you think about the children's program, there was a time when young kids, we were teaching them in schools how to talk about, like, divorce and other hardships in their family, but there was no language to talk about how they were feeling when their loved ones are using substances. No language whatsoever. And so in our history, kids would come to the children's program, still do, and they say things that will melt the whole room. They'll say, I thought you were drinking because you didn't love me, to their mother or father. It is heartbreaking to hear because they don't have another way to process what's happening other than they must be at fault or that their parents don't love them. And it's heartbreaking to hear, but through that heartbreak comes such tremendous resiliency and healing. And I think Jerry Moe, who founded the children's program, was able to take that language, and then he did a partnership with Sesame Street. So now there's a character who's on Sesame Street who talks about her parents' addiction and recovery journey boldly. And so what a gift that is to millions of children who continue to grow up in homes where there's addiction, that their parents are not bad people, that this is not their fault, that they can be kids and have fun and not have to hold all of this baggage on their shoulders, and to just give them an outlet to do that. And we do the same in the family program, but I think the children's program is very special and powerful in how it conveys that message.
Absolutely. And intervenes early, right, to hopefully prevent what we call adverse childhood experiences.
Yes.
So that pain of and loneliness and of all that comes with that as a child, hopefully you can intervene and prevent it. And whether it's giving the support or tools, I just think it is absolutely incredible. How do kids get in, though?
Well, we take anybody who is willing to come. And so, and if they need funds, we have financial aid available for them to come. And so they just have to know about the program, and arrange transportation, and their parents or their guardians have to be willing to sign off on it. And oftentimes their family members are in treatment or they've been through treatment. Sometimes their grandparents bring young people in. But it's all through that. And we have now the children's program in multiple states, and it's really a blessing, and to families. And we continue to amplify it. We now have a digital app for families, and we're doing more with publishing in the children's program. And so, post-pandemic, we want to continue to grow those family services, because it's not just the person getting help. The people around that person who love them are also incredibly isolated, and they have their own quality of life to think about, and they don't have an outlet. This is not something you can just go talk with a playground friend or a neighbor so easily. It has a lot of stigma, a lot of questions about what's normal, how much it is me, how much it is them, how much is the disease. I mean, there's a lot of questions, and to break through that. And we've evolved our family services even more, though. Instead of just telling people to have boundaries, we've now found through the science, though, that family members can learn skills. It's still not their fault, but they can learn skills to be a part of the solution. And so now we teach them these skills to be able to engage and communicate more effectively with their loved one. And we find that actually improves their quality of life and the outcomes of the person that they care about.
That's interesting. The other option is just detaching, leaving, running away, right? Because I can't deal with this, forget it, unless I have tools.
Right.
So let's do a little 180 here. I know you've also written a book for parents of a child who is in recovery. And I don't know if that's adolescent or, adult child or what it is, but what about that book? What is it called, and what is it all about?
The book is called Recovering My Kid, and I wrote it a while back, and it kind of started, it's a niche book for parents who have young people who are going through some kind of treatment or a recovery process. But it has a lot of just general parenting principles that I picked up as a child psychiatrist in training, working with a lot of families. And I've been trained in family therapy myself. And basically, when I was working at our young adult and youth and young adult campus in Plymouth, Minnesota, I was saying the same thing. We were having the same dialogue with every single family member. And I think there was an idea to why don't you actually put this on paper? And so we did that. And so a lot of the content of that book comes from just what I know works from having had so many thousands of conversations with family members and the journey that they're going through. And so we continue to give it out at our youth site. It wasn't designed to be a bestseller. It was really just designed to be a tool for people in a very specific predicament. And it's been good. It's been really good feedback on it, and parents seem to enjoy it. And it's near and dear to me because I when I approach young people with addiction, what I always say is if you can engage the family members, you got a chance. But if you don't engage the family members, that's really tough. Because the family members continue to be oftentimes the largest influence in that young person's life.
Well, I find it interesting. When I was pregnant with my first child, there was a great book. A lot of mothers used to go to it. I'm sure there are newer books, but it's called What to Expect When You're Expecting.
Yeah, I've heard of that. Yeah.
The follow-on to that should have been What They Didn't Tell You in the Delivery Room. Yeah. And then the third one would be a book similar to what you're talking about, or the children's program. Because what I learned, there's no definitive, book on what to do when you find out your loved one is sick with this disease. Because I think science, normal science, if it's cancer, diabetes, whatever, or lung disease, there are certain protocols. Your physician will be great. He'll be helpful. All these things, the steps that you're going to take, to me, in my experience, are the same steps that you have to take when you're dealing with the disease of a substance or alcohol use disorder. That it's different. And the difficulty there is friends and family are not always the most helpful people.
No. I think they try, right?
Yes.
But they tend to give this is what happened to me, or this is how I did it, or here's somebody that was successful. And oftentimes that makes the family member involved feel like it was their fault or that they're defective compared to their peers. And they're also going through this tornado of emotions. And it's like the seesaw. In a book, I call it a pendulum, where, they'll have a good day and they want to give their, young person a chance, and then something else happens, and then pendulum swings the other way and they get incredibly angry, and then they regret being that angry, and so then the pendulum swings the other way and they end up giving it a chance because they're trying to make up for being really angry the other day, but then now there's this problem happening. And I think it's really hard for these caregivers to find, kind of mindfulness and some emotional perspective. And so the book really just helps parents have that perspective so they can apply the skills the right way.
We'll continue with our interview in a moment, but first I'd like to thank my sponsors. Lucy Pet Foods is the leader in gut health. Their formulas for life feature prebiotic, balanced fiber that nourishes your dog and cat's total health. Every purchase helps support the Lucy Pet Foundation, a 501c3 charity helping animals. Save 15% off your first order and use the promo code SAGELYSPEAKING, all one word, and you will get free shipping at lucypetfoods.com. If you're committed to tackling the opioid and addiction crises, then you need to be at the 2025 RX Summit. Use code SAGELY, that's SAGELY, for an extra $100 off. Join top experts and professionals as we share strategies for prevention, deflection, treatment, and recovery. Don't miss this chance to be part of the change. Head over to rx-summit.com to register now. That's rx-summit.com for an additional $100 off. Mothers for Awareness and Prevention of Drug Abuse, driving solutions to prevent drug abuse and overdose deaths by focusing on prevention through education and awareness. And now, back to our interview.
I spent a little time on your website yesterday, as you imagine I would. You do a lot more than just addiction. You do mental health all on its own as well. And I went down your list of items of things that you could be helpful with. I mean, stress. I'm like, oh, this is a really good resource, this website. And so I just want to encourage people, too, that there's an awful lot on your website. And I think the publishing that you all do, it seems that there is something for everybody and some sort of help. Is that correct?
Yeah, I mean, we've improved our website quite a bit. Now there's a chat function. People can take a screening questionnaire if they're curious. And so there's lots of ways for people to get help on our website. Tons of people visit it. And we do offer a lot of mental health services because most people with addiction have mental health issues. It's kind of like saying most people with high cholesterol also have high blood pressure. It's not an independent thing. They usually come in pairs. And you have to address both at the same time. And so we've broadened our services to do that. But that really kind of organically also came from my clinical background, because treating young people, managing the medications, doing the therapy, talking to the families, prescribing Suboxone, whatever it is, you're kind of doing it. And I used to say, I used to work like an Italian restaurant, and that everything is kind of family style. You're doing everything at once. And what we're really trying to do at Hazelden Betty Ford is give people all of that value at one intersection, and whether it's our book or our publishing, whether it's the family or children's program, the individual services, the mental health services, the groups, the community, we want to give all of that together. And we want the best kind of product and value of services. And we really believe in that. And so, because we measure it with outcomes, with our data. And so, our website and all our offerings have lots of different on-ramps for people.
And what is your website, please?
It's hazeldenbettyford.org.
There you go.
Yeah.
There you go. Well, I actually consider you guys to be the gold standard in the world. Now, I have a lot of friends at other treatment centers who are profit and nonprofit who are quite good, but I still believe you guys are the very best. But over the years, I wanted to talk to you about the changes that we've seen. Now, first of all, whether it's money that is being, appropriated for this problem, or lawsuits that are being settled, and so the money is there. So that's a change, right? That there are actually some funds available rather than fighting for every little crumb. But I think that's a change. And then, thanks to COVID, telehealth is a change. Now, are these both, obviously the money is good, provided it's going to the right places, the right people, the right treatment. But are these things both good? The money that's flowing and telehealth.
I think they can be good. We offer telehealth services on the outpatient side, and there are people who can't drive to a clinic, or the drive is too far. And so it gives people this advantage of having that community feeling. Is it the same as being in person? No, it's different, but not necessarily worse. We've done research with Emory University, 2 papers to show that virtual groups can be just as good as in-person groups. But there are differences, in kind of how it feels, culture, how people move up and down the treatment continuum of different levels of care. So there are differences. But I think there's a lot of telehealth right now, and I worry that those systems are not really integrated with the rest of healthcare, that they're not really connected in a great way. And so if someone does telehealth and they struggle, I don't know where they go or if those workflows have really been sorted through, and if these systems are communicating with each other to help people, because you need just more than that one point or intersection. And I think similarly with the money, it's great that opioid abatement is following through. And we've definitely tried to leverage some of those proceeds to help community members, prevention programs, family programs, and whatnot. But it all kind of depends on the state legislature and how that money flows and what priorities are being emphasized. And so I think both telehealth, the changes in the marketplace, opioid abatement money, they can really be good, but it needs to be executed well and done well. You've also seen some of this stuff with retail health, where there's a lot of retail health. Now it's contracting a little bit, at drugstores and whatnot. And so I think the disruption for the marketplace is good because at the end of the day, it's going to be good for the people who are consuming. And telehealth is here to stay. And we want to continue to invest in telehealth, but it should be one part of a larger integrated system.
Who oversees the quality of all of these, whether it's telehealth or whether it's these treatment centers, which, by the way, 30 years ago, there were so few and now there's so many. So what about the oversight? Is that lacking?
Yeah, there probably is oversight that's lacking in terms of outcome data, fidelity to a model. You started to see some articles in the New York Times about certain mental health players getting in some hot water, and there have been documentaries about them. And I think what's really important for us being a nonprofit is that we don't have investors. There are no investors behind the curtains pushing us to drive margins. Our mission is to live up to the standard that Mrs. Ford set for us, live up to the promise and the dreams that those founders in 1949 had. That's our mission. And so beyond a certain point, we just want to invest back in the mission and serve more people. And that makes us a very different creature than like a for-profit animal. And I think consumers need to understand that difference because many for-profits that are really large are completely decentralized. So you'll have all these sites and they're all named different things. Like one is called Whispering Willow, the other one's called Babbling Brook. Completely disconnected. There's no core centralized function to make sure there's quality or data or outcomes. And we're the opposite. We have a mission. We want to make sure that everyone who goes to a Hazelden Betty Ford campus, whether it's virtual or outpatient or inpatient, has the same quality of care. And so we try hard for that. We have a research institute that looks at our data so that we know the fidelity of what we're doing and the outcomes it produces. The insurance companies we partner with also know our outcomes and know that they're very favorable, and that's where the gold standard stuff comes from. It's part of it is the brand and the legacy, but part of it is the outcomes and the commitment to quality that because of the strength of our mission and because we're a nonprofit.
I have to applaud your trustees at that point.
Yes.
And I know a number of them, and I've known some who've come and gone on that board, but they demand that. They
Yes.
demand excellence and they demand results. And I think it's extraordinary to see. And I'm glad you've pointed out the difference here. And it's kind of an obvious point. It's like a duh moment in the for-profit model. And I'm not going to disparage them whatsoever. That would be way too broad a stroke to paint.
We're capitalists in America, and so we're not knocking for-profit versus nonprofit. But in this segment and in the context of some of the trouble that I think some of our competitors have gotten into, I think it's important to understand how the organization is set up. Some of the things that we do, family and children's services, our publishing arm, our graduate school, our Butler Center for Research, a for-profit might look at that and say those are lost leaders and you got to get rid of those programs. We think differently fundamentally, right? So we're not looking to satisfy an investor. We're saying these programs are important for our value proposition to the community. And so it's the incentives behaviorally are different, and our board members love that. Our board members are incredibly successful people who have been touched by recovery, either personally or through their family. And so they live and breathe and understand the mission. They know organically like how they benefited from it, how important the mission is. And so this is not a knock on other people. It's just to say that if we're really aiming to be the gold standard, how do we set that standard for ourselves and how do we continue to push ourselves to do better?
While you do it. I'm just saying you continue to do it, and I'm so proud of that fact. Well, let's talk about your grad school. This was something too that you all started and created. You saw a need that was unmet. So what is your grad school doing?
Yeah, our grad school, I mean, there's a lot of mental health need, and everybody's talking about workforce and talented people who go into it. Our graduate students can do both mental health and substance use counseling. So they can do them both. And our grad school is really poised for growth. So our grad school historically came around at a time when addiction medicine was more stigmatized than it was now. And there needed to be a semblance of professionalism, that this was a professional degree. And so that was the real advocacy of it. But now I see this incredible opportunity to for equity. And what I mean is Kevin Doyle, the CEO of the grad school, and I spoke, it must have been 2.5 years ago. And he mentioned to me one day, like, Joe, technically, I found out that you don't have to have a bachelor's degree to get a master's degree. And I was like, what are you talking about, Kevin? And he's like, yeah, according to the bylaws, you don't technically have to have a bachelor's degree or a master's degree. And immediately I thought about two groups of people. People who through their recovery journey have lost some years, productive years to go to college and stuff, and they now work on campuses. They may be sponsors in AA meetings. They may be techs on our campus. They don't have the fancy papers, but we believe they can make a difference. They still got to do a grad school load, so the admission process isn't easy. And then I also thought about a population, people who are marginalized, diverse communities, people who have been cut out of the equation. And, maybe on a Native American community, the best they have is a community college, and it's not a 4-year degree. And what about their ability to impact their community and have a master's degree, come back to it, and really make some positive change? And so we thought about those populations. We created this alternate admissions pathway in our grad school, and it's been super successful, and it continues to grow, and it's something that Kevin and I are really, really proud of. And so the grad school, both symbolically and in reality, is doing a lot to satisfy the workflow, the force needs of the communities.
You and Kevin should be proud.
It's a kudos to Kevin and the faculty there it's really historic, because when we talked about equity and diversity, we were not about soapboxing. We were more from kind of the recovery spirit of the recovery spirit is this belief in humanism, the belief in individuals that no matter who you are, you have that capacity to change, and that really has fueled a lot of our efforts. And it's good to see that the grad school now is a program that lives up to those standards.
Just pivoting a little bit here, should we have foreseen the opioid crisis coming?
Yeah, we should have. I remember I'm not saying I was the only canary in the coal mine or whatever analogy you want to use, but I did this article in 2010 or 2011, I forget, and for Minnesota Public Radio. And it was on the web, and I said something to the effect of, there's this thing I'm noticing where these prescription drugs are turning into heroin with the young people that I see, and we need to do something about it. And then as it started to unfold, it really hit us. We had to, as an organization, make some changes and adopt medications for opioid use disorder because we knew that saved overdoses. By itself, it's not recovery, but you got to keep people alive. You have to have people alive so that they can enter recovery. And so we have a really robust program where we use medications and recovery principles. We should have caught on to it. But, the economic forces were what they were, and the opioid epidemic had many phases. There was the oxycodone prescription drug phase where it was predominantly suburban pills were getting out there, and then once that supply started to dwindle, the medical establishment started to choke out the oxycodone supply, for example. Then it started to go to heroin. Then heroin started to turn into fentanyl, and so it's had different waves in the opioid epidemic, and we should have seen some of them coming. I remember seeing rather entrepreneurial kids, if you will, kids who are dealing. I've seen a lot of kids who deal drugs, and they're very clever with how they deal drugs, and they would tell me about buying fentanyl through the dark web using Bitcoin as a transactional agent, and so I remember going to a Mayo Clinic conference and talking to a fentanyl sales rep, and I said, fentanyl is going to be like huge news in a couple of years. And he couldn't believe it. He was like, he just couldn't believe it. But I knew what I was seeing on the ground. So I think, could we have gotten ahead of it? Possibly. Yeah, I think we could have gotten ahead of it. But, I was in a very privileged viewpoint where I was seeing these young people and the changes on the ground. I don't blame the country for kind of what happened. It's all kind of in hindsight anyway. And I think we just have to continue to do better, moving forward.
It's true. I think we have to make sure that when we see these indicators in the future, we recognize them sooner than we did before. And I'm not talking about you, but I am talking about the numbers of government agencies that have a role in the oversight in all of this and recognizing an epidemic before we see it. Obviously, the trends were there. We were seeing it on the ground. We were seeing it in our families, in our communities. As a member of Congress, I was being introduced to families who had lost a loved one in about 2007, 2008. Yet we were so much pushed back by the typical folks, you would imagine, who would say we were wrong. And, there was something about undertreated pain, and nobody wants to see undertreated pain. Let's just get that out and state it very clearly. We do not want to see people who are in pain undertreated. However, if there's a Controlled Substances Act, then we ought to do our job. The people who are responsible for doing their job, and that is keeping these drugs out of the hands of our children, then they should do those jobs. That's what we're saying. That's what we've asked for over a decade. It's not about undertreating people with pain, whether it's acute or chronic. So I'm on my soapbox, Doc. I'm sorry.
No. I think that this is where you and I met, is in those kind of congressional meetings. You were such a strong advocate for parity and the recognition of this as an epidemic. And, and I remember doing the same. And I think there were a lot of voices there. And so it's definitely a tragic moment in American history. What's kind of interesting now is that the overdose death rates have dropped a decent amount in the past year. Not in every single state, but it is dropping. And what's contributing to that is actually kind of interesting. And so I think it's not just treatment or harm reduction standards. It's also just something is changing in the macro to reduce some of the opioid epidemic casualties. And people are still speculating as to what that might be. But hopefully that's more good news, coming up, that, the epidemic is losing some strength.
Let's hope. For me, it's all about prevention and awareness. And you mentioned prevention earlier. What is your view of effective prevention? What do we need to do more of?
Yeah, I used to say this a lot when I used to do more speaking or at conferences, but the science is pretty clear that you can predict which young people might be at high risk for developing addiction when they're in grade school, years before they use substances. And that's shocking to people because they haven't touched anything yet. But you can tell through their psychology and some of the features they have that probably signal out a certain kind of genetic makeup. Of course, there's environmental factors too, but intervening on these young people is incredibly important. And so you want to prevent before there are any symptoms. That's the best kind of prevention. And then of course, as symptoms start to show themselves, there's different layers of prevention, secondary, tertiary prevention. But the best prevention is to really instill skills, awareness within the individual family systems and communities so that you don't have the problem in the first place.
What I've learned is that most families tune out. They don't believe this is going to happen to them. And, the word fentanyl, immediately people think this is something going to happen down the road, down the block, somebody else's house, somebody else's city. And unfortunately, that's not the case, because now it isn't just addiction. It is the fentanyl crisis. It's the one pill can kill. So it's changed. It's morphed entirely. And so for me, prevention is raising the awareness. And I think, boy, hundreds of nonprofits, I think, do a lot of great work in this space. And I don't mean a nonprofit like you all, but I mean so many mom and pops who've lost a child. Yes. And, we work collectively a lot together. But I think, so I just have a couple more questions for you. And you've been, like, oh my guests, so generous with your time, and I appreciate it. First is, what do you hope to see, without getting into politics, or if you want to, feel free. But, as people listen to this, it could be next month, it could be next year, it could be 5 years from now, who knows? So just generally speaking, what do policymakers in Washington, D.C. specifically need to do differently, if anything?
I think parity needs to become a real thing on the ground.
Can you explain parity a little bit for those who
Yes.
might not know?
To your average listener, it's parity is kind of like equality. Like how do you treat behavioral health conditions like addiction on par with how treatment for other medical illnesses are provided? And right now, if you have an addiction, in more cases than not, you have to prove to some other party that you have a serious enough problem to get medical help. Whereas if you had a similar medical condition, if you had chest pain, you would just go to the emergency room and they would figure it out. But everything from the certification process to the reimbursement process to the lack of investment in the infrastructure are quite different in addiction versus kind of physical health. And I'd say even within the behavioral health, mental health realm, addiction is kind of well known to be an outlier and stigmatized even within the mental health corridor. And so true parity that changes reimbursement, accessibility, that changes resources, allows people to get help when they have to get help instead of having to prove how sick they are. I think those are really important. And I think at the high level, they've passed bills for parity. But enforcing that on the ground to make sure that's really done, I think is going to be very important in the next 5 years.
Absolutely. As Patrick Kennedy likes to say, get your checkup from the neck up. And,
Right.
and it should be considered. I just can't believe that we're still fighting that fight on parity. It's a preventative, measure. I think whether physically or mentally, it just makes perfect sense to me. But
Yeah, people are going to be shocked by this, but if you go to any hospital, and I've had conversations with many hospital CEOs, behavioral health investments just don't pay the bills for them. And so parity isn't just about shame and stigma. You're not incentivizing healthcare providers to invest in resources to address an issue because those behavioral economic dynamics make it so that if you go to a mental health unit or you're seeking addiction services from any major hospital, you're kind of sent to the back annex or the basement or, the less nice place. And it's for a reason. It's not because those hospitals are cold-hearted. It's because those are the economic behavioral dynamics at play. And so parity, a true commitment to parity would solve many of those problems. But I think fundamentally there's not an incentive to make the necessary investments because those parity issues exist.
well, that's too bad. And I think it does discourage R&D, correct? I mean, it doesn't seem that we've done a whole lot. I think your point is we haven't seen a lot of advancements, I guess MAT and buprenorphine and some of these things, but compared to any other disease, we're way slow to see the advancements that we need. It could save a lot of lives. But I just want to close with this, if I may, unless you want to keep going and want to tell me more. And I can.
No. I'll just say that, the funny thing is there are now lots of advancements coming. There's research on everything from psychedelics to, TMS, transcranial magnetic stimulation, and there's innovation that's coming. But I think one of the things people don't know is that as a chronic illness, the outcomes for addiction, despite what you read about the truth and overdose deaths for opioids and whatnot, but in general, the outcomes for addiction as a chronic illness are better than heart disease and diabetes. So this is a treatable, okay? This is the treatable lifelong chronic illness. It's not something that there's no hope in. There's actually tons of hope. And it goes back to the community things you've talked about and the scientific elements. And people should know that because sometimes people are like, well, maybe there can't be parity because nobody gets well. It's just not true.
This is very important. And I love that you're bringing us to an uplifting and hopeful place on this. And I have seen it with my own eyes, actually, throughout my life. Yes, it is a very treatable chronic disease. And yes, it has its ups and its downs, but hang on to hope and believe. And whether it's a 12-step program or whatever people might believe in, whatever they need to do, I've seen it, I've witnessed it, lived it, and endured it. But this brings me to, I want to close on something that's important to me and my friends, my producer Kim, who's on this podcast, watching us as we speak. We do Dry January, We help each other, we support each other, we laugh, we share mocktail recipes, we do all of that. And then we're proud because I think Kim lasted a lot longer than I did, but I'll last until like March. And then I'll have, Betsy bar the barn door, whatever they used to say, because it's over. But I love Dry January, and I love to encourage other people to give it a try. And so I just wanted to bring that up with you and say, am I off my rocker or think that Dry January does me some good?
Oh, absolutely. Dry January does you a lot of good. We know that any amount of alcohol now versus what they used to tell us that a little bit of alcohol is good for you is not good for you. But, as an organization, Hazelden Betty Ford, we're not anti-substances. We're not anti-alcohol. We treat addiction. It's a very different thing. But from a public health perspective, reducing alcohol intake for anybody is probably a good idea for their health, especially if they have underlying conditions. And think about it culturally, like all the happy hours. I just did an interview for Newsweek or something on this, where they were talking about these mocktails and the advent of these mocktails and, non-alcoholic brews and what are they like for people? What's the impact? And I just think that it's time that culturally, when people want to get together, they have to have some other kind of glue other than alcohol to get together. And I think mocktails are a great alternative for that. And so it's been interesting to watch that economy really boom. And I was also asked if non-alcoholic beverages can be helpful for people who are looking to get in recovery. And that's a different picture because the way addiction works, the anticipation and the lead up to the use is actually almost more important than the actual use itself. And so just using a mocktail doesn't get rid of the people, places, and things that happen on the lead up to the mocktail. And so that's a bit of a digression, but I think it's great. Dry January is a great kind of public health statement. And I hope that there's continued dialogue and kind of resetting social norms. Look at all the people who work and have holiday functions or happy hour functions, and I don't think they should have the pressure to drink if they don't want to.
Hey, it's why pickleball is so special and important. Everybody's playing it too, right? So social function
Right.
without having to drink and other options like that. And but Dr. Lee, thank you so much for being here.
Well, thank you, Mary. From your life story to your advocacy to representing us in Congress, you've done and you continue to do so much to uplift the voices, the stories of people in recovery. And I think it'll make a world of difference. All of us working together, talking together, normalizing what the recovery journey is, and it'll pay off in future generations. So thank you for all you're doing.
It is a labor of love for me, but I just want to thank my listeners for listening to Dr. Lee. I think these are great words. I think we barely touched on the surface of a lot of these issues, but hopefully it was enough to give you some curiosity and to go to the website and to check out everything Dr. Lee has talked about. Again, that is hazeldenbettyford.org. If I am correct, I'm getting a nod from the camera, which is good. And again, thank you to you who are listening to this today. I appreciate very much that you listen to Sagely Speaking. To those of you who have sponsored us, thank you very much. We couldn't do this without you. And lastly, if you're watching this on YouTube, thank you. I think it's my favorite platform because we have little snips there that are a lot of fun, and we call them shorts, and we hope you'll check them out. So again, thank you very much for being here. And until next time, be well.